Nurse Practitioner National NP Certification Exam. Question 1. A 65-year-old male presents with a harsh systolic murmur heard best at the right second intercostal space that radiates to the carotid arteries. What is the most likely diagnosis? Option A. Mitral regurgitation. Option B. Aortic stenosis. Option C. Mitral stenosis. Option D. Aortic regurgitation. The correct answer is option B. Aortic stenosis. Aortic stenosis is a systolic murmur characterized by a crescendo-decrescendo sound at the right upper sternal border with radiation to the neck. Question 2. According to the JNC8 and ACC/AHA guidelines, what is the first-line antihypertensive for an African American patient without CKD? Option A. Lisinopril. Option B. Losartan. Option C. Chlorthalidone or amlodipine. Option D. Metoprolol. The correct answer is option C. Chlorthalidone or amlodipine. For the Black population, thiazide-type diuretics, like chlorthalidone, or calcium channel blockers, CCBs, are more effective as initial therapy. Question 3. A 24-year-old female presents with a Harold patch, followed by a Christmas tree distribution of smaller macules. What is the diagnosis? Option A. Tinea corporis. Option B. Pityriasis rosea. Option C. Secondary syphilis. Option D. Psoriasis. The correct answer is option B. Pityriasis rosea. Pityriasis rosea typically starts with a large Harold patch and progresses to a symmetrical rash along skin cleavage lines. Question 4. What is the gold standard for diagnosing a pulmonary embolism? Option A. D-dimer. Option B. Chest X-ray. Option C. CT angiography, CTA. Option D. Arterial blood gas, ABG. The correct answer is option C. CT angiography, CTA. CTA is the preferred imaging modality to visualize a clot in the pulmonary arteries. Question 5. Which cranial nerve is assessed when asking a patient to shrug their shoulders against resistance? Option A. CN7. Option B. CNX. Option C. CN11. Option D. CN12. The correct answer is option C. CN11. Cranial nerve 11, spinal accessory, controls the trapezius and sternocleidomastoid muscles. Question 6. A patient with a TSH of 12.5 μ/L and a low free T4 should be started on what medication? Option A. Methimazole. Option B. Levothyroxine. Option C. Radioactive iodine. Option D. Propranolol. The correct answer is option B. Levothyroxine. Elevated TSH with low T4 indicates primary hypothyroidism, which requires thyroid hormone replacement. Question 7. What is the first-line antibiotic for an adult with uncomplicated acute cystitis? Option A. Ciprofloxacin. Option B. Nitrofurantoin, macrobid. Option C. Amoxicillin. Option D. Doxycycline. The correct answer is option B. Nitrofurantoin, macrobid. Macrobid is preferred for uncomplicated UTI due to rising resistance to other agents and its targeted efficacy in the bladder. Question 8. Which of the following is a classic finding in a patient with iron deficiency anemia? Option A. Macrocytic/hyperchromic RBCs. Option B. Microcytic/hypochromic RBCs. Option C. Normocytic RBCs. Option D. Elevated vitamin B12. The correct answer is option B. Microcytic/hypochromic RBCs. Iron deficiency leads to small, microcytic, and pale, hypochromic, red blood cells due to insufficient hemoglobin. Question 9. A 30-year-old male presents with a sandpaper texture rash, high fever, and a strawberry tongue. This suggests option A. Measles. Option B. Scarlet fever. Option C. Mononucleosis. Option D. Lyme disease. The correct answer is option B. Scarlet fever. Scarlet fever, group A strep, presents with a sandpaper rash and circumoral pallor alongside the strawberry tongue. Question 10. Which medication is contraindicated in a patient with a history of sulfa allergy? Option A. Metformin. Option B. Hydrochlorothiazide. Option C. Lisinopril. Option D. Amlodipine. The correct answer is option B. Hydrochlorothiazide. Many thiazide diuretics contain a sulfonamide group and should be used with caution in patients with severe sulfa allergies. Question 11. A patient has a positive McMurray test. This indicates a potential injury to what structure? Option A, ACL. Option B, MCL. Option C, meniscus. Option D, Achilles tendon. The correct answer is option C, meniscus. The McMurray test involves rotation of the knee to detect clicks or pain associated with a meniscal tear. Question 12. What is the drug of choice for treating Rocky Mountain spotted fever in both adults and children? Option A, amoxicillin. Option B, doxycycline. Option C, cephalexin. Option D, azithromycin. The correct answer is option B, doxycycline. Doxycycline is the first-line treatment for all tick-borne rickettsial diseases, regardless of the patient's age. Question 13. A psoas sign and obturator sign are physical exam maneuvers used to assess for option A, gallstones, option B, appendicitis, option C, pancreatitis, option D, kidney stones. The correct answer is option B, appendicitis. These signs elicit pain in the right lower quadrant, suggesting irritation of the peritoneum due to an inflamed appendix. Question 14. What is the target A1C for a healthy, non-pregnant adult with type 2 diabetes according to the ADA? Option A, less than 6%. Option B, less than 7%. Option C, less than 8%. Option D, less than 9%. The correct answer is option B, less than 7%. The general goal for most adults is an A1C of less than 7% to reduce microvascular complications. Question 15. Which of the following is a hallmark of delirium compared to dementia? Option A, slow onset over years. Option B, acute onset with fluctuating levels of consciousness. Option C, permanent memory loss. Option D, normal attention span. The correct answer is option B, acute onset with fluctuating levels of consciousness. Delirium is an acute medical emergency characterized by sudden changes in cognition and attention. Question 16. According to the Beers criteria, which medication should be avoided in the elderly due to high risk of falls? Option A, metformin. Option B, amitriptyline. Option C, lisinopril. Option D, atorvastatin. The correct answer is option B, amitriptyline. Tricyclic antidepressants, TCAS, like amitriptyline have strong anticholinergic effects and cause sedation/orthostatic hypotension in seniors. Question 17. A 14-year-old presents with Osgood-Schlatter disease. What is the primary clinical finding? Option A, pain at the heel. Option B, pain and swelling at the tibial tuberosity. Option C, pain in the hip. Option D, curvature of the spine. The correct answer is option B, pain and swelling at the tibial tuberosity. Osgood-Schlatter is an overuse injury causing inflammation of the patellar tendon at its insertion point on the tibia. Question 18. Which of the following is an example of primary prevention? Option A, a mammogram. Option B, a colonoscopy. Option C, influenza vaccination. Option D, physical therapy after a stroke. The correct answer is option C, influenza vaccination. Primary prevention aims to prevent the disease from occurring in the first place, e.g., vaccines or exercise. Question 19. What is the gold standard for diagnosing a corneal abrasion? Option A, fundoscopic exam. Option B, fluorescein staining with a Woods lamp. Option C, visual acuity test. Option D, intraocular pressure measurement. The correct answer is option B, fluorescein staining with a Woods lamp. Fluorescein dye will collect in the abrade area and glow bright green under cobalt blue light. Question 20. A patient with COPD has an FEV1/FVC ratio of option A, 0.80, option B, 0.70, option C, exactly 1.0, option D, variable, changes with inhaler use. The correct answer is option B, 0.70. A post-bronchodilator FEV1/FVC ratio of less than 0.70 is the diagnostic threshold for airflow obstruction in COPD. Question 21. Which antidepressant is most likely to cause weight gain and sedation, making it useful for elderly patients with insomnia? Option A, sertraline. Option B, fluoxetine. Option C, mirtazapine. Option D, bupropion. The correct answer is option C, mirtazapine. Mirtazapine, Remeron, has strong antihistamine properties that increase appetite and promote sleep. Question 22. What is the first-line treatment for a patient with polymyalgia rheumatica, PMR? Option A, methotrexate. Option B, high-dose ibuprofen. Option C, low-dose prednisone. Option D, infliximab. The correct answer is option C, low-dose prednisone. PMR typically responds dramatically to low-dose corticosteroids, 10 to 20 mg daily. Question 23. A patient presents with a curtain-like loss of vision in one eye. This is an emergency and suggests option A, cataracts, option B, glaucoma, option C, retinal detachment, option D, macular degeneration. The correct answer is option C, retinal detachment. Sudden, painless loss of vision described as a curtain or shadow is a classic sign of retinal detachment. Question 24. What is the screening recommendation for lung cancer in high-risk smokers, age 50 to 80? Option A, yearly chest X-ray. Option B, yearly sputum culture. Option C, yearly low-dose CT, LDCT. Option D, bi-yearly bronchoscopy. The correct answer is option C, yearly low-dose CT, LDCT. LDCT is the only approved screening method that reduces mortality in patients with a significant smoking history. Question 25. Which medication class is the first-line treatment for chronic venous insufficiency? Option A, diuretics. Option B, antibiotics. Option C, compression stockings. Option D, anticoagulants. The correct answer is option C, compression stockings. Compression therapy is the mainstay of treatment to improve venous return and reduce edema. Question 26. A positive Prain sign, relief of pain with scrotal elevation, is often seen in option A, testicular torsion, option B, epididymitis, option C, inguinal hernia, option D, hydrocele. The correct answer is option B, epididymitis. In contrast to torsion, where pain usually stays the same or worsens, lifting the scrotum often relieves the pain of epididymitis. Question 27. Which heart sound is a hallmark finding in an adult with congestive heart failure? Option A, S1, option B, S2, option C, S3, ventricular gallop, option D, S4, atrial gallop. The correct answer is option C, S3, ventricular gallop. The S3 heart sound occurs during the rapid filling of a dilated ventricle, often associated with fluid overload. Question 28. What is the most common cause of secondary hypertension in adults? Option A, obesity. Option B, renal artery stenosis. Option C, pregnancy. Option D, stress. The correct answer is option B, renal artery stenosis. Renovascular disease is the leading, identifiable, cause of hypertension that doesn't respond to standard medications. Question 29. Which of the following is a symptom of vitamin B12 deficiency, but not folic acid deficiency? Option A, anemia. Option B, fatigue. Option C, neurological symptoms, numbness, tingling, ataxia. Option D, mouth ulcers. The correct answer is option C, neurological symptoms, numbness, tingling, ataxia. B12 is essential for myelin maintenance, so its deficiency causes peripheral neuropathy and cognitive changes. Question 30. A 19-year-old presents with high fever, stiff neck, and a petechial rash. What is the priority? Option A, administer Tylenol and reevaluate. Option B, perform a strep test. Option C, immediate referral to the emergency room for suspected meningitis. Option D, prescribe a 10-day course of amoxicillin. The correct answer is option C, immediate referral to the emergency room for suspected meningitis. Meningococcal meningitis is a life-threatening infection requiring immediate hospitalization and 4 antibiotics. Question 31. What is the treatment of choice for trigeminal neuralgia? Option A, sumatriptan. Option B, carbamazepine, Tegretol. Option C, prednisone. Option D, oxycodone. The correct answer is option B, carbamazepine, Tegretol. Anticonvulsants like carbamazepine are the first-line treatment for the shocks of nerve pain in the face. Question 32. Bouchard's nodes are found on which part of the finger? Option A, distal interphalangeal, DIP, joint. Option B, proximal interphalangeal, PIP, joint. Option C, metacarpophalangeal, MCP, joint. Option D, the wrist. The correct answer is option B, proximal interphalangeal, PIP, joint. Bouchard's equals PIP, Heberden's equals DIP. Both are signs of osteoarthritis. Question 33. Which of the following medications is a biguanide? Option A, glipizide. Option B, metformin. Option C, pioglitazone. Option D, sitagliptin. The correct answer is option B, metformin. Metformin is the only drug in the biguanide class and is the first-line therapy for type 2 diabetes. Question 34. A patient with atrial fibrillation is at high risk for what complication? Option A, pneumonia. Option B, embolic stroke. Option C, liver failure. Option D, hypothyroidism. The correct answer is option B, embolic stroke. The quivering of the atria allows blood to pool and form clots, which can then travel to the brain. Question 35. What is the gold standard for diagnosing osteoporosis? Option A, X-ray of the hand. Option B, dual energy X-ray absorptiometry, DEXA, scan. Option C, calcium blood levels. Option D, bone biopsy. The correct answer is option B, dual energy X-ray absorptiometry, DEXA, scan. A DEXA scan measures bone mineral density. A T-score of -2.5 or lower is diagnostic. Question 36. Cullen's sign, periumbilical bruising, is a clinical indicator of option A, ruptured ectopic pregnancy or acute pancreatitis. Option B, appendicitis. Option C, liver cirrhosis. Option D, peptic ulcer disease. The correct answer is option A, ruptured ectopic pregnancy or acute pancreatitis. Cullen's sign and Gray-Turner's sign, flank bruising, indicate retroperitoneal or intra-abdominal bleeding. Question 37. Which heart murmur radiates to the axilla? Option A, aortic stenosis. Option B, mitral regurgitation. Option C, aortic regurgitation. Option D, mitral stenosis. The correct answer is option B, mitral regurgitation. Mitral regurgitation is a hollow systolic murmur heard at the apex with radiation to the left armpit. Question 38. A 50-year-old female reports a sudden, thunderclap, headache, the worst headache of my life. This is likely. Option A, migraine with aura. Option B, cluster headache. Option C, subarachnoid hemorrhage. Option D, tension headache. The correct answer is option C, subarachnoid hemorrhage. A sudden, explosive headache is a classic sign of a ruptured aneurysm and requires an immediate CT and neurosurgical consult. Question 39. What is the standard treatment for Lyme disease in an adult? Option A, azithromycin. Option B, doxycycline 100 mg bid for 10 to 14 days. Option C, penicillin G. Option D, amoxicillin for 3 days. The correct answer is option B, doxycycline 100 mg bid for 10 to 14 days. Doxycycline is highly effective against Borrelia burgdorferi, the causative agent of Lyme. Question 40. Which lab value is most sensitive for evaluating iron stores in the body? Option A, serum iron. Option B, hemoglobin. Option C, ferritin. Option D, hematocrit. The correct answer is option C, ferritin. Ferritin measures the body's actual iron reserves and is the first value to drop in early iron deficiency. Question 41. A patient has Hefner's sign, pain on passive extension of the finger, and sausage digits. This is likely. Option A, gout. Option B, psoriatic arthritis. Option C, osteoarthritis. Option D, carpal tunnel syndrome. The correct answer is option B, psoriatic arthritis. Psoriatic arthritis often presents with dactylitis, sausage digits, and characteristic skin lesions. Question 42. What is the first-line treatment for GERD, gastroesophageal reflux disease, that is not controlled by lifestyle changes? Option A, surgery. Option B, H2 receptor antagonist or PPI. Option C, daily antacids. Option D, antibiotics for H. pylori. The correct answer is option B, H2 receptor antagonist or PPI. A 4 to 8 week trial of a proton pump inhibitor, PPI, is the standard initial therapy for persistent GERD. Question 43. Which of the following is a classic sign of hypocalcemia? Option A, positive trousseaux and cross-deck signs. Option B, weight gain. Option C, increased deep tendon reflexes. Option D, high blood pressure. The correct answer is option A, positive trousseaux and cross-deck signs. Trousseaux, carpal spasm, and cross-decks, facial twitch, occur due to increased neuromuscular excitability from low calcium. Question 44. A patient with gout should be told to avoid which type of food? Option A, dairy products. Option B, leafy greens. Option C, high-purine foods like organ meats and shellfish. Option D, chicken breast. The correct answer is option C, high-purine foods like organ meats and shellfish. Purines are metabolized into uric acid, which crystallizes in the joints during a gout flare. Question 45. What is the therapeutic INR range for a patient taking warfarin for atrial fibrillation? Option A, 1.0 to 1.5. Option B, 2.0 to 3.0. Option C, 3.5 to 4.5. Option D, 5.0 to 6.0. The correct answer is option B, 2.0 to 3.0. The standard target for most indications, including AFib and DVT, is an INR of 2 to 3. Question 46. Which of the following is a negative symptom of schizophrenia? Option A, hallucinations. Option B, delusions. Option C, flat affect of volition. Option D, disorganized speech. The correct answer is option C, flat affect of volition. Negative symptoms represent a lack of normal function, such as social withdrawal or lack of emotional expression. Question 47. The dawn phenomenon in a diabetic patient refers to: Option A, low blood sugar at 3 a.m. followed by high blood sugar in the morning. Option B, a physiological spike in blood sugar in the early morning due to growth hormone release. Option C, the need for a snack before bed. Option D, the patient's desire to wake up early. The correct answer is option B, a physiological spike in blood sugar in the early morning due to growth hormone release. Treatment involves increasing the evening dose of basal insulin, unlike the Somogyi effect. Question 48. Which medication is used to prevent pneumocystis jirovecii, PCP, in HIV patients with a CD4 count 200? Option A, fluconazole. Option B, trimethoprim sulfamethoxazole, Bactrim. Option C, acyclovir. Option D, rifampin. The correct answer is option B, trimethoprim sulfamethoxazole, Bactrim. Bactrim is the standard prophylaxis for PCP in immunocompromised individuals. Question 49. What is the primary treatment for acute prostatitis in a 40-year-old male? Option A, surgery. Option B, a 4 to 6 week course of a fluoroquinolone, like ciprofloxacin, or Bactrim. Option C, a 3-day course of amoxicillin. Option D, watchful waiting. The correct answer is option B, a 4 to 6 week course of a fluoroquinolone, like ciprofloxacin, or Bactrim. The prostate gland is difficult for antibiotics to penetrate, requiring a prolonged course of therapy. Question 50. A 35-year-old female has a unilateral headache behind the eye with tearing and nasal congestion. This is option A, migraine. Option B, tension headache. Option C, cluster headache. Option D, sinusitis. The correct answer is option C, cluster headache. Cluster headaches are suicide headaches characterized by severe, piercing, unilateral pain and autonomic symptoms. Question 51. Presbyopia is defined as: Option A, loss of high-frequency hearing. Option B, loss of near vision due to age-related stiffening of the lens. Option C, loss of night vision. Option D, inability to see far away. The correct answer is option B, loss of near vision due to age-related stiffening of the lens. Presbyopia is the long-arm syndrome that usually begins in the early 40s. Question 52. Which of the following is a common side effect of ACE inhibitors? Option A, peripheral edema. Option B, dry, non-productive cough. Option C, weight gain. Option D, constipation. The correct answer is option B, dry, non-productive cough. The accumulation of bradykinin in the lungs causes a dry cough in about 10 to 20% of patients on ACEIs. Question 53. What is the gold standard for diagnosing a meniscal tear in the knee? Option A, X-ray. Option B, ultrasound. Option C, MRI. Option D, CT scan. The correct answer is option C, MRI. MRI provides the highest detail of soft tissue and cartilaginous structures in the joints. Question 54. A patient is diagnosed with hyperthyroidism. What is the most likely underlying cause? Option A, Hashimoto's thyroiditis. Option B, Graves' disease. Option C, thyroid cancer. Option D, iodine deficiency. The correct answer is option B, Graves' disease. Graves' disease is an autoimmune condition and the leading cause of thyrotoxicosis. Question 55. Which of the following is a Level 1 evidence in research? Option A, case studies. Option B, expert opinion. Option C, systematic reviews and meta-analyses of RCTs. Option D, cohort studies. The correct answer is option C, systematic reviews and meta-analyses of RCTs. Systematic reviews represent the highest level of evidence for clinical decision-making. Question 56. A 12-month-old infant is expected to be able to do which of the following? Option A, run 100 meters. Option B, say 1 to 3 clear words and stand alone. Option C, tie their shoes. Option D, use a spoon perfectly. The correct answer is option B, say 1 to 3 clear words and stand alone. Milestones at 1 year include pull to stand, walking with help, and mama/dada specific. Question 57. Which medication is the first-line treatment for anaphylaxis? Option A, diphenhydramine, Benadryl. Option B, methylprednisolone, Solomedrol. Option C, epinephrine, 1:1000. Option D, albuterol. The correct answer is option C, epinephrine, 1:1000. Epinephrine is the only medication that can reverse the airway and circulatory collapse of anaphylaxis. Question 58. A S4 heart sound is most commonly associated with? Option A, fluid overload. Option B, a stiff, non-compliant ventricle, hypertension or LVH. Option C, mitral stenosis. Option D, normal findings in teenagers. The correct answer is option B, a stiff, non-compliant ventricle, hypertension or LVH. The S4, atrial gallop, occurs when the atria contract against a stiffened ventricular wall. Question 59. What is the legal ethical principle of non-maleficence? Option A, doing good for the patient. Option B, treating everyone fairly. Option C, the duty to do no harm. Option D, the patient's right to choose. The correct answer is option C, the duty to do no harm. Non-maleficence is the core requirement that a provider must not cause injury to a patient. Question 60. Which screening test is used for abdominal aortic aneurysm, AAA, in men aged 65 to 75 who have ever smoked? Option A, CT scan with contrast. Option B, abdominal ultrasound, one time. Option C, chest X-ray. Option D, palpation only. The correct answer is option B, abdominal ultrasound, one time. The USPST recommends a one-time screening for AAA by ultrasonography in this specific population.